We have a few minutes for comments or questions.
Yes, I'm Jim Bogdan with the National Association of State Boards of Education. The CDC School Health Education and Policies and Practices Survey found that between 2000 and 2012, the number of school districts requiring physical education has dropped at the elementary, at the middle, and at the high school level. The number of school districts requiring nutrition education has dropped at all levels. The only curriculum area where health education has grown is violence prevention, and I think we all know the reason for that. So our current strategies have failed. I think the roundtable on obesity prevention needs to take a critical look at how to promote these policies in the education system. The Education Department is the U.S. Education Department is absent from these discussions. CDC is no longer funding staff in state departments of education to promote these policies in education departments. Somebody has to pick up that slack if we are going to make progress. Thank you.
Any comments?
Thank you for your comment. I agree with that. I think the problem we have is we've allowed things to be removed from the institution over the last decade, and now it's incredibly hard to get it back in. And one thing I recommended, and I know many people are working on, is to generate more evidence that demonstrates the benefit so that we can bring it back. That will help with the conversation, but I totally agree that it's a bit of an uphill battle right now to get it back in since it's been removed.
Hi, Lowell Solomon from Kaiser Permanente. I'm on the Obesity Solutions Roundtable. A couple of you mentioned the accumulation of evidence now about the connection between health outcomes and educational outcomes. Given that accretion of evidence, what needs to happen in order to use that to engage school stakeholders, which understandably are more focused on academic achievement and census and some of those other things, to engage in school health?
Well, from my perspective, it's more in the way that it's communicated, getting to my point about communication. So a lot of the evidence has been published, and it's come out in different forms. It's pretty much presented only at public health or health-focused conferences. So I think it's two pieces. One is how we actually talk about it, whether it's in conversation at a conference, in influencing and informing a school board or a state board of education, to use more education language rather than health language. That's very much missing. And then the second piece, I don't think we've done the best job to actually truly overlay where we see education disparities and health disparities and looking at the population. There are a lot of data sources out there from large school districts, from rural schools, and I think that if we dig a bit deeper and are able to look at and overlap where there's education disparity and where there's health disparity, and again, take that and actually make a strong message, we'd have a lot more impact in people kind of perking up who are making the decision.
And the one thing I might add to that, because I absolutely agree where we're talking about it, how we're talking about it, it's also who's talking about it, in that some of the best advocates for this and the people who have really lived the change are superintendents, principals, people who have worked in districts and schools where they've implemented healthier changes and actually seen really positive outcomes in practice, because we can all feel really confident in the data, but ultimately until you see that play out in practice, one still is understandably skeptical about what that's ultimately going to mean in their specific population. So I think making sure that we're providing opportunities for those folks who are genuine advocates due to the natural experiments or their intentional changes in their own districts is going to be really critical to helping to move that culture forward and helping to bring more schools into the conversation.
And I would add PE teachers to that list. And I think a lot of what Chris talked about is really engaging those champions who are making the changes and they're seeing the changes in their classrooms. Being able to get them engaged in spreading the message is also really key.
Thank you. And then Russ, and I know you're thrilled that this focused on physical activity.
I am indeed. Russ Pate, North Carolina. The idea that we should take action to improve and enrich our school physical education programs is not a new one. Though, Chris, the recommendation that you made that we include PE as a core subject is a relatively new approach to this. Hasn't happened. There's not one of the 50 states currently include physical education in its core educational assessment effort. And I guess to continue the theme of the conversation, and what do we need to do? What can we do to make that happen? Because I think I would agree with you, until we get that done, we're going to be swimming upstream.
Yeah, that's why I said we need some schools, some districts, some forward-thinking groups of people to take this on. I think it'll be hard to have it statewide, but I've seen pockets of people around the country who are willing to do this. And if we systematically conduct a study where we find those groups and we're able to help them and provide the assistance to take it on, I believe we can generate the data that could spark national change. So it's another example where trying to do it federally or even at the state level might be really tough, but I do believe at the district level or maybe even clusters of schools, it's absolutely possible. It won't happen without funding. So we need someone to step up with the funding so we can collect the data and actually generate the evidence we need to convince others. And I agree, it's being spoken about, all these emerging data, but it's a bit scattered. And I think despite there have been some good reports that have consolidated it, we need to do a better job at packaging it and telling the story in a more robust way.
And the other thing I'll just say from a policy change perspective is it's going to take one, right? You've got to get that one state to demonstrate it. So thinking about where, if there's interventions taking place, clustering them such that there's opportunity to start moving something up and hitting a tipping point in one place is going to be the key to then expanding that over time. So that's kind of part of the broader theory of change there.
We have time for just one quick remark.
Good afternoon, everyone. My name is Don Chell. I'm the Director of Chronic Disease for the State of Maryland Department of Health and Mental Hygiene. So I wanted to interpose some hope for a little bit of the gloom that I'm hearing at the end. And so the State of Maryland uses its Community Transformation Grant funding and its 1305 chronic disease funding to address school wellness policies across the State of Maryland. We're looking at all of the recent changes for nutrition and physical activity. Then Dr. Maureen Black and Dr. Aaron Hagar at the University of Maryland School of Medicine, Department of Pediatrics are working to revamp wellness policies across the state of Maryland in our school system and to look at the barriers that staff have to implementing them, both staff at the administrative level and staff at the teaching level. And so our 1305 dollars, our chronic disease dollars, we're using to look at chronic diseases and nutrition and physical activity in the school system. And so there are funds available, but health departments across the country have to work very closely with their departments of education. But there is hope, and a part of the Community Transformation Grant requires us to contribute to the literature. And so within the next year or so, we hope that with Dr. Hagar and Dr. Black, University of Maryland School of Medicine, Department of Pediatrics, we'll have something to help contribute to the evidence and how we can move this forward.
Great.
Thank you. We need to move on, but I'd like to thank the school panel.